Spokane Public Schools are experiencing a shortage in bus drivers. We are asking parents how this is impacting their kids.
It's strange to see patients that are our peers and they could be our friends, and they're working jobs similar to ours.
Treating patients during a health crisis. We'll hear from one local nurse who shares with us what it's like working in the ICU.
And in weather, we are tracking another nice day again on Wednesday, but still on track for much cooler and wetter weather towards the end of the work week and into the weekend. I'll have your forecast coming up.
Good evening and thank you for joining us for Krem2 News at 5 tonight. I'm Mark Hanrahan.
And I'm Tom Sherry. Whitney's off tonight.
For this year is significantly more problematic than other years.
Well, developing tonight, a nationwide bus shortage is impacting students right now in Spokane Public Schools.
Yeah, Durham bus services say drivers recently quit over the vaccine mandate. The shortage has even impacted high school sports.
Krem2's Amanda Rowley has been pressing for answers today. She joins us live in the newsroom with what she found out. Amanda?
Hey, good evening. This is the greatest bus driver shortage Durham Bus Services has ever experienced, and that's according to its spokesperson, Edward Flavin. Now, he could not pinpoint why there is a bus driver shortage, but Flavin confirms 11 drivers have resigned since Washington's vaccination mandate. Now, he told me over the phone Durham is meeting with Spokane Public Schools tonight to explore options that best serve its bus routes. We can also confirm the district sent out a text alert and email last night saying Durham is looking for substitute and permanent drivers. We also know last night's Ferris and Shadle High School JV football game was canceled when no buses showed up. Durham spokesperson confirms it just did not have a driver for those games. Now, SPS parents have told us their students' buses have picked them up late or not at all. Devani Audit is an SPS parent who also serves on the district's Citizen Advisory Committee. She told me what she and other parents have experienced with buses recently.
I get text messages from the schools when buses are late, and I'm getting these messages daily that buses are late picking kids up in the morning, which means that they're out waiting, which is safety problems. Yesterday at the elementary school, there was a bus that was an hour late picking the students up.
Now, Durham emphasized to me its bus drivers are working tirelessly to transport students despite the current shortage. Now, again, we hope to learn more tomorrow after SPS meets with Durham to find solutions to the current driver shortage. Now, Durham says any reasonable option will be on the table. Reporting in the newsroom tonight, Amanda Rowley, Krem2 News.
Thank you, Amanda. Hospitals in North Idaho are still operating under crisis standards of care. Kootenai Health in Coeur d'Alene is still treating more than 100 COVID-19 patients as of today.
Yeah, Kootenai Health leaders held a press conference again today to give us an update on the situation inside the hospital. Krem2's Ian Smade joining us live there in Coeur d'Alene tonight with more on how Kootenai Health is handling the current surge. Ian?
Mark, Tom, as of earlier today, Kootenai Health was treating 108 COVID-19 patients, and of those patients, 33 were in critical care and 14 were on ventilators. Now, the nurses here at Kootenai Health have been constantly caring for these patients, and earlier today, one nurse shared their experiences inside those rooms. Kootenai Health is still in the midst of its worst COVID-19 surge yet, and those on the front line say the people they are treating for COVID didn't think it could happen to them.
If they're able to talk, if they're not on a ventilator, a lot of them say, I didn't think that it would be me who's sitting in this bed. I thought it was either all political or all a hoax or just people who are in poor health or maybe don't take care of themselves as well who are getting this sick.
Since August 25th, Kootenai Health says 87% of its COVID patients haven't been fully vaccinated. Most had not had a single shot of the vaccine. Leaders say they are seeing 10 to 15 new COVID-19 patients a day. Treating these patients has been tough on nurses as they try to provide comfort for people dying, going as far as writing down a patient's final goodbyes.
One of my coworkers transcribed 25 letters to different family members and loved ones with her goodbyes and whatever notes she wanted to add. And that's, I guess, one example of something it's really hard for us to take on emotionally.
The strain isn't just on the healthcare workers caring for these patients. Resources are running thin. 9 beds are being used in an overflow space normally set aside for classrooms and conference space. Patients are being treated in other non-traditional areas around the hospital. One other worry for Kootenai Health leaders is a lack of space to care for children.
what we're thinking is that we probably could do somewhere between like 8 to 12 at this point in time. But if we get a really significant pediatric surge, it probably won't be sufficient. So we are looking at other ways that we might be able to expand that further if needed.
That comes as Kootenai Health Chief of Staff Dr. Robert Scoggins said they don't think they've seen the effects of the North Idaho State Fair or the start of the new school year. This has led to concern about providing care in the case of a surge in cases among children, paired with a lack of pediatric resources in the region.
Our big concern is that that the regional pediatric ICU capability could be overwhelmed, and we'll have to take care of them here.
One bright spot for Kootenai Health in recent days has been the deployment of monoclonal antibody treatments. Scoggins said they've helped keep people out of hospital beds as they use it for outpatient treatment and in the ER. Scoggins also said they've been sending some patients home with oxygen supplies to keep beds free. Reporting in Coeur d'Alene, Ian Smay, Krem2 News.
Ian, thank you. And on that topic, after a delay, monoclonal antibody treatment started today in North Idaho at the Kootenai County Fairgrounds. COVID positive people in the area with mild to moderate symptoms can now get that treatment. So here's how it works. You must first go to your primary care physician and get a referral. You should have a condition that would make you have a higher risk of developing a severe case or hospitalization, like a heart disease. And you must be older than 12 years old.
Well, today we asked interim health officer in Spokane how our local hospitals are handling the influx of patients from across the state line. We know of at least 30 North Idaho patients who have been transferred to COVID units right here in Spokane. But the real number is likely more, and it is part of the reason our Eastern Washington hospitals are also becoming overwhelmed. As we told you earlier this week, Spokane facilities are not yet in crisis standards of care like they are in North Idaho, but we are in contingency care. At this point, it means hospitals are juggling available healthcare workers just to try to keep up.
I think our hospitals and healthcare systems are trying to maximize the staffing that is available to work in the hospital. And one of the ways to do that is by decreasing the number of either ambulatory procedures and or clinics so that staff can be redeployed to the hospital.
At a press conference today, Providence Chief Medical Officer made it clear our region's hospitals are the closest they've ever been to a breaking point.
We're dealing with an emergency that just keeps getting worse and worse and worse, and we're not sure where it's going to end.
A day after Providence announced it will stop all non-emergency procedures, Chief Medical Officer Dr. Dan Getz was clear our hospitals have never been this stressed.
We're at the highest level of admissions since the beginning of the pandemic, and we're closest to the breaking point that we've ever been.
He said there are 18 patients in the ICU on ventilators. Not a single one is vaccinated. A frustrating fact for physicians because none of those patients statistically would have been in the ICU if they were vaccinated, and a dangerous reality for those patients.
When you're unvaccinated and you get put on a ventilator for COVID, the odds of you getting off of that and living, it's roughly 60% chance of dying. It's like a flip of a coin, basically. Are you going to live or going to die?
Given the current situation, Dr. Getz says he simply can't believe our local leaders are allowing the Spokane Interstate Fair to take place right now.
I'm incredibly concerned that we have a big fair going on in Spokane. That makes zero sense in the middle of a pandemic, and we're hearing reports that we're lucky if a quarter of those patients are wearing masks. And so what it tells me is the community doesn't understand the level of crisis that we're dealing with. They don't understand the incredibly difficult decisions that we're making and delaying care in people that have cancers that we should be reviewing now because we need to make space for them in our hospital in case they get sick.
And for those who say getting vaccinated is a personal choice, he says they're wrong.
And I hear the argument over and over again that it's a personal decision, but I'll tell you it's not a personal decision, because if you require hospitalization and care, it's taking care away from that patient with cancer that's waiting to get that removed. It's taking care away from that patient that he needs their hip or their knee replaced. This it impacts us all. It's a population health issue.
Well, this is a lot of information, so if you'd like to read more about the COVID surge happening in Kootenai County and Spokane County, you can text the word COVID to 509-448-2000. We'll send that link straight to your phone.
All right, Tom, let's pause from the headlines for a moment to talk weather because, my goodness, certainly starting to feel like fall. And the temperatures from here are just going to kind of drop a bit.
Absolutely.
And also going to get wet out there, right?
I think so. Tomorrow's another dry day, but by the time we get to Friday night, soaking rains expected. We started out with sunshine today. Now you can see we've got the cloudy skies and 68 degrees. Also windy, 22-mile-an-hour winds out there. The clouds don't look overly impressive on that satellite and radar picture, but look up ahead, look up to the heavens, and you see just cloud cover. But again, no rain yet from those. We'll look for mostly cloudy skies overnight. 67 the expected high tomorrow. Friday night the rain begins, continues through the weekend. 62 on Saturday. Might even get a thunderstorm or two on Sunday, and a daytime high of only 62. The average high this time of year is 75, so it's going to get much cooler. I'll check the rest of your 7-day forecast coming up in a few minutes.
We don't transition well, so we just hit a switch, right?
We're done.
My goodness, Tom, thank you very much. And still ahead here on Krem2 News at 5 tonight, the number of children getting COVID is increasing. Our Verify team looks into how they're being treated and if that differs from adults.
Then later, scammers are at it again, this time going after people with Medicare coverage. We'll tell you what you need to look out for. That's coming up ahead.